Does your elderly parent have the capacity to make decisions about their own life, or are they incompetent? What are these words and what do they mean? I think a lot of people use these words interchangeably and they're using them wrong. So we're going to straighten it all out for you today, and you're going to know where your parent falls. Hi there, I'm Sophia. I make weekly videos to help you be a more satisfied, more successful, and more informed family caregiver. And if you don't want to miss anything, then go ahead and subscribe now. There is a lot of misunderstanding and wrong information out there about capacity and competence. So hopefully today is going to clear that up for you. A lot of our elderly parents make really irrational, unsafe decisions. Does that make them lack capacity, or are they incompetent to make decisions on their own? And what are you supposed to do about it? Let me start off by defining capacity and competency. They are from two different worlds, these two words. Capacity is a medical term, while competency is a legal term. Capacity has to do with a person's ability to make a specific decision at a specific point in time, while competence has to do with a person's global ability to make decisions on their own. Capacity can only be assessed by a physician or other medical person, while competency can only be assessed by a judge or through the courts. Capacity can change through time. It can change within a half an hour. It can change between today and tomorrow, whereas competency generally doesn't change. Capacity generally has to do with, can that person make a competent decision right here and right now? And with competence, if they are deemed incompetent by a judge, then that generally means their capacity is not going to change over time. Capacity can change a lot because of things that are going on with your parent. It could be that they have a UTI and they're confused, or they have a lot of pain medication and it's making them so drowsy they can't respond to you. That means in the moment they may lack capacity, but if you ask them again in a day, that capacity could return. So generally, when we're talking about and worrying about our parents' ability to make decisions about how they live and medical treatment, we're usually talking about capacity. When you're talking about competency, that is a more, the global term, that is a legal term that you go through the courts and they're going to do an investigation and they're going to deem whether or not this person will ever be able to make decisions on their own again. That's when the court might step in and assign a person to be a conservator or a guardian of that senior, because the court and the judge has deemed that they are no longer able to make any decisions on their own. And I am going to go into capacity because that's usually what we are referring to when we're talking about our parents and concerned. And there are 4 parts of capacity. But before I start that, I want to make sure that you're aware that just because our parents or your parent suffers from dementia or even Alzheimer's, or if they have a mental health issue like severe depression or bipolar disorder or schizophrenia, does not necessarily mean they lack capacity to make their own decisions. So the way that you determine if a person has capacity, or I should say the way a doctor would determine if your parent has capacity, is to look at 4 different areas. So there are 4 criteria that must be met before a doctor can determine capacity. And I'm going to also broaden that as you and I, as the children of elderly parents. There are 4 things that need to happen before we can even start thinking that our parent lacks capacity. So the very first thing is your parent has to have all the information about what's going on. So for instance, if it is regarding medical care, your parent needs to have been told by a physician what their condition is, what the treatments are, what will happen if they didn't get treatment, what will happen if they do get treatment, what are the outcome possibilities, what are the risks, what are the benefits, including the risk of death. So the first thing is that they need to know all the information to be able to make a competent decision. So when we're talking to our parents, let's say our parent wants to make what we think is a bad decision about staying home in an unsafe environment alone. Does your parent know what all their options are? Do they know, have you told them explicitly what will happen if they stay home alone and they fall? Do they know what all their options are? What is it going to cost? How will that happen if they need to make a change or get help in the home? Have you talked through all of the different details that are necessary in order for your parent to make a capable decision? The second criteria that must be met is that your parent has to be able to communicate what their decision is. And that's the easy part. Do they say, yes, I want that, no, I don't want this? A lot of our parents, unfortunately, aren't able to verbally communicate. They can't write things down. They might not even be able to nod. And so it's really hard if you're trying to communicate with someone who is only able to blink. It's hard to determine if they really do understand and are they able to communicate what their desires are. That is a requirement for having capacity. The third factor that's important in determining capacity is your parents' ability to appreciate what their decision will mean for them. And this doesn't just mean them saying, I'll be fine, leave me alone. It means them being able to rephrase back to you all of the ramifications of their decision. Can they tell you what will happen if they make that decision, what their outcomes will be, what their risks are, and how severe the situation is? If they're not able to communicate back to you their understanding of what the risks are and what the possible outcomes are, then they might lack capacity. If they are just telling you, don't worry about it, I'll be fine, you'll have no way of knowing if they really understand what the possible outcomes of their decisions are. The fourth element that's required in determining capacity is, can your parent tell you logically why they are making the decision that they want to make? Let's say they need dialysis and they're saying, no, I don't want dialysis. Are they able to say why they don't want dialysis? Can they tell you a good reason? A good reason for them, not necessarily a good reason for you, but can they logically say, well, my brother had dialysis, he was on it for 5 years, it took so much time to go down to the center 4 times a week and sit there for hours. I don't want that. That's not how I want to spend the rest of my life. That's reasonable and logical. But if they can't say why, then that might be an indicator that they lack capacity. They need to be able to say why it is that they're making these decisions. So when it comes to more of talking to our parents about their care, if they're refusing to go to a nursing home, if they can logically tell you the reason, like they don't want to be in a facility when they pass away, they'd rather be at home, that they don't want to linger with tubes and nobody around them except for doctors and nurses, that's logical. But if they can't tell you why, if they don't understand what their decision is going to do, then perhaps they lack capacity. But if your parent says something like, I just want to go home and die, like they don't want medical intervention because they just want to go home and die, that is not a logical response that a doctor should accept as them having capacity. Essentially, you're not allowed to say you don't want intervention as a means to a suicide. that would mean that they require a medical assessment by a psychiatrist and probably go to a psychiatric hospital. Unless they're saying something other than that and can give you a logical explanation for their decisions, then they do have a right to make that decision. Even if it's a decision that you absolutely hate, that you think is unsafe, that you think is stupid, it is their human right to make that decision. And often the adult children that I work with, they don't want to hear it. They want to take over and they want to make decisions for their parents. But all of us, including you, when you are old, have an absolute right to make decisions about yourself as long as you meet all the criteria and you have the capacity to make that decision right now. And that means even if they're putting themselves at danger. I think that's the hardest part of being a family caregiver for our elderly parents, is we can't always intervene. We can't always step in and save them. They have a right to make decisions about how they live. And sometimes we have to wait until there's a crisis before there can be an intervention. All we can do is love them, respect them, and understand that it is their right to make a decision. So I hope this video clears things up a little bit on capacity versus competence. Usually what we're talking about is capacity. Unless you're trying to seek out guardianship or conservatorship for your parent, then you're going to need to go through a court process to deem them incompetent. Those words are not used interchangeably, so be careful. I hear it a lot of adult children saying, my parent is not competent to make a decision about home care, where that it doesn't really make sense. So I hope this clears it up a little bit about the difference between capacity and competency. If after listening to this video you question whether your parent has the capacity to make decisions about their care and what goes on with them, where they live, what kind of care they get, if you question their capacity, then your next step is to take them to the doctor and let the doctor do a full assessment to see if they think they have capacity to make that one particular decision. If there's a concern that your parent lacks all ability to make all decisions, then you're talking about competence, and in that case is when you'd want to seek out an attorney and see if your parent needs to have a conservatorship or guardianship. So I hope this helped you today clear things up. If this information was helpful, please go ahead and leave me a comment. Don't forget to subscribe. Thank you so much for watching. I'll see you next time.